Welcome to the session. Hopefully people will find this useful. We're going to have a talk through some of the kind of communication differences that we might see working with autistic adults. Some of the strategies that we might consider utilising to support communication, identifying communication strengths and where needs are, and how we might think about making reasonable adjustments in terms of communication as well. So we're going to start off by introducing ourselves. So, we're going to start off by telling you what our aims are. So we are looking at increasing understanding about the communication strengths and needs of autistic adults. We are focusing on the population who don't also have a co-occurring learning disability. Talking about the impact of the communication needs on mental health and well-being. How we need to consider the environment, context and multiple disadvantage and the impact of those. Discuss some of the communication barriers and areas of breakdown, and then think about some strategies and reasonable adjustments. So that's what we're hoping to kind of get through. I mean, it's in an hour, so we won't be going into depth like we might do if you gave us a day. But yes, that's what we're hoping to kind of look at today. So just a bit of an introduction to ourselves first. So where we work. So I'm Vic, who's sat next to me, and myself. We're with the Community AMH ASD Support Project, and Kavita is with the Nest service. So I'll just tell you a bit about the Community AMH ASD Support Service first. So I'm Jess Renton. I'm a speech and language therapist. I wear a couple of different hats in terms of services that I work into within Notts Healthcare Trust. And we have Vic.
Yeah, and I'm Vic, and I'm the assistant speech and language therapist for the service. And I too have a couple of hats, but I have two jobs, and they're both 2 days a week.
And the Community AMH ASD Support Project is a really new service within the Trust. So we started 3 years ago as a 3-year pilot project to work across all community adult mental health services within Nottinghamshire City and County, to work with the community AMH services around how we make reasonable adjustments to support autistic adults to better access mental health support. That's what we've been doing. After the first year, we were made into a permanent service, but we are still teeny tiny. So there's still myself and Vic, and that is it. We are the service, but we offer consultation, reflective practice and supervision to staff who are needing our support. We offer workforce development, so we do lots of training sessions, trust-wide, bespoke for the individual services and at an individual level as well. We also reach out into wider services where that's appropriate. We support the dynamic support register. We also have involvement in the Autism Transformation Programme and Complex Case Forums. We develop lots of resources, which we will talk about later on. And if anyone here has accessed our service, I definitely recognise some names. So pretty sure you will have received some of the resources that we've worked on. And you will have our inquiry form and our project poster included in your resource pack at the end. I'm going to go on so that Kavita can introduce herself.
Hiya, I'm Kavita. So I work into the neurodevelopmental specialist service, also known as NEST. It used to be known as NCAS, if anyone ever knew us before, but that service has kind of grown to include ADHD as well as autism. So we diagnose people with both of those conditions. So we also offer support to help people understand their diagnosis after that's given, and also certain specialist support from our MDT. So that could be sort of specifically about communication. It could be support with managing sensory differences. And we also have lots of NMPs, so nurse prescribers, who work on the sort of medication pathway for ADHD. So yeah, in terms of our service, we don't specifically support people or work on sort of with people on their mental health, as that's done through the mainstream local mental health teams. But in terms of our MDT, we have speech and language therapists like myself, and we have OT, occupational therapists, we have psychologists, psychiatrists, and as I mentioned, the nurse prescribers as well. So we work in line with sort of nice guidelines in terms of diagnostic assessments and the way we work in general. Thank you.
Cool. So I think.
Yeah, so we're going to talk about autism, obviously, in this presentation. So with this slide that you can see, so moving from the highly sort of medicalized model, which might sort of seek to pathologize or put an emphasis more on disorder or dysfunction, neurodiversity was a paradigm shift, which put more focus on sort of celebrating people's differences in thinking and brain structure. And it kind of, again, like I say, puts more emphasis on acknowledging what the strengths are, but also it does also acknowledge sort of the needs that people might have in terms of support or treatment. So kind of reframing things in this more positive way aims to kind of support with sort of reducing that stigma, reducing discrimination, and sort of in turn trying to promote people's understanding, acceptance, and improving sort of quality of life for people that may come under that neurodiversity umbrella. So as you can see on this image that we've got there, we've got things like ADHD, autism, dyslexia, dyspraxia, dyscalculia, I can never say that one, so I apologise. And we've got developmental language disorder on there as well. And, you know, there is some debate as to other things that could be included under this umbrella too. So, and also to mention, there can be a lot of sort of overlap, and these diagnoses can co-occur with each other. Okay, next slide.
Which I think is really increasingly understood, isn't it, as well? So it's kind of, historically at one point, if you had an autism diagnosis, you couldn't then have an ADHD diagnosis, and absolutely that has evolved and is not the case at all. Significantly more likely to have more than one neurodevelopmental diagnosis.
Yeah, definitely.
Oh, sorry, I got distracted.
That's all right.
Oh,
so you might just need to click through these just to bring up everything.
Right, okay. Easier. There we go.
Yeah. So obviously this slide offers a few statistics in relation to autism, so I'll just read some of them out. So 28% of autistic adults have co-occurring ADHD. 80% of autistic adults experience mental health difficulties in their lifetime also, and that's through that info is from Autistica. And also recent research suggests that 12.3% of people experiencing homelessness are autistic compared to 1.2% of the general population, which is a big discrepancy. And only 2 of 40 people with communication needs had previous experience of speech and language therapy. So obviously these points, they kind of emphasize that we need to be even more aware of those crossovers and the risks, and also what the support that may be needed. And also many people are undiagnosed or maybe mislabeled or misunderstood. And due to communication difficulties, people may find it really difficult to kind of ask for help or influence the input that they receive, or, you know, in gaining the right support. They may also struggle to access therapy, which often by default is verbally mediated, can be quite prescriptive, so not bespoke to them or their style of thinking, and they're often quite time-limited packages as well. So yeah. Did you want to add anything, Jess, or happy to go to the next one?
Yeah, no, happy to. Yeah, absolutely. That's really
yeah. So with this slide, it kind of breaks down a little bit sort of the diagnostic criteria and the diagnostic manual that's used. So that's the DSM for assessing autism. And just to clarify, so we might say autism, we might say autism spectrum disorder, or autism spectrum condition, or ASD. They're all sort of meaning the same sort of thing. So in terms of the criteria, so a person must have persistent difficulties with social communication and social interaction. So this might be things like the language that they use, the language that they understand, and how they may interact with people. The second part of the criteria is restricted and repetitive patterns of behaviour, activities or interest, and this includes sensory behaviour. So, for example, people may have certain topics that they are very interested in. They may find structure and certainty really is helpful to them in managing their anxiety and their understanding. And sometimes in terms of sensory differences, there may be some sensations that they really enjoy, or the opposite. There may be certain sensations that they find really, really difficult to tolerate. So also important to mention that autism is a neurodevelopmental condition. So by that, we're sort of meaning that the symptoms and that presentation, it must be lifelong and present since childhood. So even if we're diagnosing someone in their sort of later years, that there needs to have been that evidence in their early years that it was just missed, as opposed to it started at a later time. And also, to gain a diagnosis, that there must be evidence that there is an impairment to a clinical level, so sort of limiting someone's everyday function. I appreciate a lot of that terminology is very sort of clinical and diagnostic terms. So we've got some slides later that kind of break that down a little bit more. And yeah, it's really important to remember that people can be very good at masking in public, for example. So, that takes its toll on mental health, and also people can sort of present in different ways. I think sort of like it's quite a dynamic presentation often. So people may be sort of really great in conversations for certain topics, but then may really, really struggle with other topics. So that can be missed and overestimated by some people, because they're kind of like, oh, that doesn't match. Just as an example. And there's a famous sort of saying that if you've met one person with autism, then you've met one person with autism, because it's a really unique presentation for each individual. Yeah, and just also to mention that sometimes people are viewed sort of an intellectual disability as being autism or part of autism. But they are stand-alone diagnoses, but they can co-occur. So I think we've got a statistic where it's sort of 20 to 30% of people with intellectual disability could also have autism. So thinking about, as I mentioned, sort of think about the importance of that language that we use, sort of as healthcare professionals, as social care professionals, we often have been taught sort of to use person first language. So saying a person with intellectual disability, as their intellectual disability isn't a core defining feature of them. They are their own person. They have their sort of personality traits and interests and everything like that. However, in terms of neurodiversity and autism, there's been a lot of research of what sort of autistic people prefer, and they have talked about that they prefer identity first language. So they prefer being referred to as autistic or autistic and an autistic person. So but just obviously always best to check with the person, that individual, what they prefer, rather than assuming. And then also think about autistic spectrum disorder. So that's the current wording in terms of diagnostic manuals. However, there's often a preference to refer to it as autistic spectrum condition rather than disorder, because obviously it sounds much more positive and it's not sort of suggesting that there's a deficit there. And also to mention Asperger's or high functioning autism. They are terms that used to be used, but they're no longer in the diagnostic manual. It's kind of all been kind of collapsed into the umbrella term of ASD or autism spectrum disorder. And yeah, there's a few other reasons why. Well, some people really relate to their previous diagnosis, if it was termed that way, of Asperger's syndrome. So, we need to make sure we're respecting that. But equally, there are some connotations to Hans Asperger's that might mean people are rejecting that as a title as well. So Yeah, so we just need to have a think about the way that we're talking about things and just checking with people, really, is the point there. Go to the next slide, Jess. I think that I'm handing over to you.
You are, yeah. So one of the things that I think really is really important, and we are very aware of how difficult or complex this can be in real life, but it doesn't take away the importance of it where we can, is the triangle of care approach to working, which is basically where we are able to talk to not just the patient or the autistic person, but also their family and carer network around them as well, to be able to kind of create a more holistic picture and understanding of what's going on for that person. It can be hugely important in terms of the information we're gathering and how we support someone. So I know that one of the people that we've worked with, if he was asked a question and he was processing it, his facial expression looked really, really angry. So people at that point would walk away. They'd leave because they thought that he was getting really angry about something. When that was then discussed with his mom, she reported that actually that face is his processing face. It's really important because he's about to share something that's really, really valuable with you. So if you stick it out, he's not a risk to you, but he's about to tell you something really important. And had we not had that bit of information for that person, we would have been missing that opportunity. So the whole way that he could be supported was then changed and influenced. So the importance of being able to kind of pull on that information from other sources to understand that person as fully as possible is just really, really key. We know it can be really difficult, but one of the things that we've created in our service is a letter explaining why this is important, so the clinician can share it with the person. Because having that conversation, it's like, I'm an adult, I can tell you what you need to know. Why do you need to speak to my family? Explaining that can be really tricky. So we've tried to kind of create a template where to support that conversation as well. But just holding it in mind, some of the risk that can occur would have been mitigated for some people that unfortunately have ended up kind of dying through suicide. Probably would have been mitigated had there been triangle of care working. We know that from across the country with different cases that have been looked at. So it's really important. So we wanted to make sure it was included, but I'm not minimizing how difficult that can be sometimes. Yeah. And then the next slide we've got is double empathy. And I'm hoping that a lot of people are familiar with this idea, but I thought maybe we should just kind of go through it again, because it's really important and it's really kind of influencing how we think about how we are supporting the autistic population, regardless of the setting. So the double empathy problem is basically a way of thinking about how both parties, so how an autistic person and a non-autistic person struggle to understand each other effectively. So there's plenty of research that shows that two neurotypical people can successfully communicate the same bit of information between each other. Two autistic people are more likely to be able to communicate the same bit of information successfully, but between each other, that can become really, really difficult. So what do we do about that? And this is where reasonable adjustments come in. This is where we think about what can we do differently to make this work more effectively. So it's about taking steps. One of the examples that a colleague used, and I don't know if they're in this, they might be here, I don't know, but if you are, thank you, because I use this a lot. But it's a bit like if you've got an Apple phone or laptop and an Android phone or laptop, so a non-Apple device, and they don't talk to each other very effectively. They don't communicate with each other very effectively. However, if you put a patch on each device, if you think about kind of making a small adjustment, then they can do it. So I think that's a good way of trying to understand it. The other way is thinking about standing on either side of a bridge. You've got an autistic person on one side and the non-autistic person on the other side. And what can I do differently? So if you're asking someone to come to a first appointment, if I send a letter with a picture of the venue, how to access it, who you might meet, the timing, what questions might be asked, I am making significant, reasonable adjustments to support that person to feel less anxious about that appointment. it's more predictable, it's clearer about what's going to happen, and hopefully they can then get to that appointment and feel prepared for it. So I've made reasonable adjustments, and the autistic person can then notice that and be able to kind of work together. So you're taking steps to kind of work closer together and sort of get through some of those difficulties. There's lots of really interesting work around and ways of kind of thinking about it. So there is a link called the double empathy problem with Dr. Damien Milton, which is a PDA, and he's the guy who kind of created the concept, I guess, as well, and developed the idea of double empathy. So that's a great resource to think about. We're not going to show this video because we've not got time, but we wanted to include it because it's a really good video to watch to kind of give people a different insight. It's quite sweary, so please don't be offended easily. It's also very funny, but it's also very eye-opening in terms of people's real experiences as well. So I would highly recommend watching the video afterwards. Just want to get it in there. Okay, so now we're going to have a think about some practical resources and support and thinking about reasonable adjustments.
Yeah, so back to me. So with this diagram, I'll give you a moment also to have a look at it, but it kind of highlights the skills that are needed to communicate effectively. And there, as you can see, there are lots and lots of steps that need to happen. For some people, this can happen really quickly and really automatically. You know, they might not have to give a lot of thought to it. But to someone who, you know, finds communication difficult, obviously, these steps have to be really, really thought about, or they may be missed out. And so it's not everyone finds it as easy. So just having a think through. So obviously, to be able to communicate an idea, we have to be able to choose which words that we're needing to use and the vocabulary. We've got to be able to think about the grammar and the sentence structure that we need to put that into. We need to be able to access what speech sounds that we're needing to put together and coordinate our muscles to articulate that sound. We need to be able to produce a voice and also use that in a fluent way. We need to be able to speak and sort of conduct ourselves in an appropriate manner. We need to be able to self-monitor. So thinking about, you know, noting what you've said, repairing that if needed. And then we also need to pay attention and look towards our communication partner. We need to be able to hear. So, you know, having that ability and also not just hearing it, but also listening to it and processing it. We need to be able to remember and retain what people have said. We also need to know what they're meaning by the words that they've used and have that same sort of frame of reference. And also thinking about the meaning of what they're saying. So what the literal meaning might be or what their underlying meaning might be, and the hints and also nonverbal communication that they're using. So as you can see, that takes quite a long time to complete, or there's lots of steps. So sometimes, you know, people with autism might find a lot of those steps might be affected for them. Obviously, different experience for each different person. And you know, thinking on top of that, you've got different things like you've got self-confidence, you've got what's happening in your environment that might affect that as well, and lots of different things. So yeah, just wanted to highlight all these different steps that make up our communication, really. Okay. So there's lots of, as you can see, there's lots of areas where communication could break down. So thinking about breaking this down as well. So understanding, so as Jess mentioned in that last slide on double empathy, it's about having a shared understanding. So if some people are using really abstract or vague concepts, or, you know, making reference to something that happened previously and assuming someone's knowledge, things are definitely going to break down. Whereas it could have been more useful if that person had said it more specifically, been really clear, or even just took a moment to just check, have they understood what I've said, and that kind of thing. Sometimes it can be quite challenging for some people with autism to sort of predict what people's perspective may be, or what they're thinking about, or what their intentions are. So, you know, that can have a knock-on effect to not knowing what to expect or how they could plan ahead in that conversation. And obviously that can increase anxiety. It can also increase the time that it might take for processing information. You know, like we talked about, there's lots of steps, or that in a moving conversation, there's a need to kind of keep up. So that can be really challenging. And if people disrupt that processing time, then it can really have an impact. It might have to start all over again, for example. Or people, you know, people have moved on in the conversation, there's a new thing to process. Sometimes people with autism that I've worked with kind of talk about that they'll overthink, or they have to overanalyze something, or double process. So they've got to think about, well, what are they saying to me literally, and equally, you know, what are the non-literal possibilities that they could also be saying. And if you've got multiple people that you've got to pay attention to, again, there's loads there to think about. So as you can imagine, it's quite effortful, it's exhausting. People often talk about they need a bit of time to decompress after having a social interaction. Yeah, there may be different things in terms of sort of the language that's used. Some people may come across really knowledgeable or use lots of technical language, and it might be specific to certain topics, and it might not be across the board. So it's kind of thinking about how other people might also overestimate their abilities when they're talking about something that's much less familiar. And then thinking about sort of body language, tone of voice. Sometimes those things can be quite distracting, or just adds an extra layer for someone to have to process. And things like emotions or nonverbal communication, they can be in the grey area. You know, there can be an obvious version of happy, but equally people could do the minute, small things with their body language that actually, you know, you have to be really picking up on all of that. A lot of people mention they avoid eye contact or don't understand it. The experience can be that it feels quite intense or uncomfortable to them. Also, the next point is thinking about having to kind of judge the context and be really flexible in applying social skills. And that can be really challenging, you know, if that context and situation just moves constantly. Like I said, it's difficult to keep track of sometimes. So we might see that some people might like to have certainty or familiarity, and certain sort of rules to follow, but that can also be misinterpreted as, you know, they're being inflexible or, you know, very rigid. And just thinking about sort of attention. So sometimes people talk about that they might find it hard to kind of, amongst all of what is said, figuring out what the most important parts of that conversation is, or like filtering out certain bits and, you know, distracting things in the environment as well. I think we were in a presentation training session the other day, and some of the people were sort of saying that the noise of the projector was all that they could focus on actually in that room, and that made it really challenging, whereas to some of the other people in the room didn't even notice it at all. So it's just really appreciating people's experiences. And sometimes it might be about sort of understanding literal or non-literal information. And, you know, thinking also there's lots of social norms and unwritten sort of ways of conducting yourselves in social situations, that is a lot to navigate, really. And a lot of people, like non-autistic people, might use a lot of small talk or fluffy words to kind of cushion certain topics to make it more palatable or to build rapport with people. But equally, that might not be, you know, like I said, that might add an extra layer of processing. So, you know, if someone says something in a more direct way, that's seen as not appropriate, but actually they're just saying it how it is, and that we can't always, I don't know, interpret that as inappropriate, if you know what I mean. So yeah, we'll move on to the next one. Being conscious of time. I'm passing it to you, I think, Jess.
Yeah, sorry, it wasn't moving. Sorry.
That's right.
Just give me a second.
Yeah.
Sorry, I had a cough sweet and I can't talk around it. Okay, so just to summarize what Kavita's just gone through, some areas that autistic and neurodiverse people can report difficulties with include things like idioms. We use a lot in the English language, we use a lot of idioms. We kind of imply information about what we are referring to by using phrases that don't really say what we mean, but we have a shared understanding of what we're trying to say. They can be really, really confusing. And thinking, holding in mind that kind of language and kind of being clear about what you are saying. If you are using an idiom, check in. Has the person actually understood what you were talking about, what you were referring to? Some people can interpret them really literally. There is a brilliant book of illustrations, Kavita, you might have to help me with the guy's name, who is autistic, and he illustrates what he sees and what he hears when he hears common idioms, and it's brilliant because you're like, oh right, okay, really, raining cats and dogs is literally, he sees it is raining cats and dogs. It's a great reference book for people to kind of refer to. It can be really tricky to, one, identify if there's been a communication breakdown and then know how to repair it as well. Unfortunately, an awful lot of the people that Vic and I work with or support have also really struggled to ask for help or say, do you know what, I didn't get that. It might be that through schooling and various other and employment and places like that, that they have been shamed out of asking when they need help. So they don't ask for help anymore because their experience of when they've done that has been negative. It's been kind of disregarded or kind of, well, you should know, or you should have been listening, etc. So people don't initiate sort of asking for help. That can be a real issue. Figuring out how to repair a communication breakdown and not taking it away and kind of it being stuck in your head and overthinking it and kind of, well, how did I get that wrong? And it becoming really stressful. Reading between the lines, which is again linked to that idiom, so kind of what are you actually referring to here, what, rather than giving implied information. Yeah. Oh, I really liked that session the other day. It's like, okay, did you actually really like that session the other day, or are you telling me actually you really didn't enjoy that session the other day? So actually just saying what you mean is a much kind of clearer, straightforward way of sharing that kind of information with people that leads to less misinformation and misunderstanding. Use of abstract language, so this can be things like time concepts, emotional literacy, identifying and understanding other people's points of view. They can all be really, really difficult skills for people to kind of really get a grasp of. They can be very, very effortful. There can be a lot of shame when you get it wrong. So like we are going to talk about some of the things that we can do to support people with these skills, but kind of holding in mind that actually if we need to use these ideas, we need to also be explicit with what we mean and what we're referring to. Hopefully that helps. So just kind of thinking about some of the phrases that we might hear when autistic people's kind of communication approaches might be kind of sort of shared or kind of thought about, and how we might reframe them. So if people are too direct, it might be that they're answering your question. You asked a particular question, you're getting the answer to that question in a direct way. We're just not necessarily used to hearing it in such a direct way. Doesn't mean it's incorrect. It might, if someone's too quiet or very anxious, it might be that they are feeling overwhelmed, they are protecting themselves. It might be that they are processing what's being said and they need that additional processing time in order to be able to respond. It might be that their sensory system is really overloaded, and in the particular environment, if there's lots of noises or the temperature's not right or the lighting is distracting and there's too many people around, there aren't enough people around, that will have an impact on someone's ability to be able to engage. Having a disorder, I think Kavita's already kind of talked about this really, but we're kind of thinking about differences, not disorders, and kind of we're moving away from that sort of medicalization and pathologizing and trying to kind of have a much more sort of neuroaffirmative consideration of what we're seeing or how we're working with people. We've definitely heard rude, arrogant, aloof in terms of how people can be perceived. So thinking about that, actually the person is kind of giving you their honest, direct opinion, because that is the language that they use. That is what makes sense. So it's kind of how we frame it in receiving it. Again, it's making that reasonable adjustment and thinking about the double empathy as well. I could keep going through all of them, but that's the idea, is kind of, rather than framing it as in a negative kind of boundary, think about why that person might be doing it in a particular way. There will be a reason. It's related to that person's the way that they are processing communication and utilize their communication, rather than being intentionally obstructive or avoidant or rude or unable to. And we also need to consider, if we're seeing these things, what can we do differently to support and facilitate that communication more effectively as well. So, but we will go on to some strategies related to that. So where we have communication differences, and this is the same for anyone who is experiencing mental health difficulties or addiction or kind of multiple disadvantages, if there is an impact on communication, there will be an impact on mental health and well-being. So if someone's experiencing frequent communication breakdown and misunderstandings, that will have an impact on how you're engaging, your willingness to engage, your ability to kind of put yourself in a potentially vulnerable social situation, and how much effort that might take, your willingness to kind of experience that level of failure without knowing how to repair it, because we've already said that repairing it can be quite tricky. So thinking about when you're seeing someone and that's their presentation, they seem to be avoiding, what's that related to? Where's that stemming from? It can have a massive impact on people accessing education and employment. There's still lots of work to be done in both settings in terms of thinking about reasonable adjustments and how we make what is a mainstream kind of provision adjusted to make it work, because there's plenty of skill sets. It's something like only 22% of autistic adults are in full-time employment. Sorry, I couldn't get the right word then, which is really low. It's really, really low. So we need to be doing better for sure. It's kind of in terms of employment. I think one of the biggest things that Vic and I see as well is the impact on self-esteem, confidence in knowing your own identity and who you are as an autistic man or an autistic woman. We see that a lot in terms of how that person understands themselves. We've worked with people who view their autism as a sort of really bad thing, a really negative thing for themselves, that they try and get rid of, or kind of may engage in sort of self-harm or create sort of suicidal ideation, because they're trying to not be autistic, and they really don't have that sort of core sense of identity, and that's really significant. We're going to talk some more about masking. I know Kavita's already touched on it as well, but that is really significant, particularly but not exclusively with our female populations. Avoidance, so managing us. Are we doing things in the right way? We might see something as avoidance, but are they actually kind of trying to manage what they can deal with and what they can't deal with? I don't know if people have heard of energy accounting or spoons theory, but I think that can be a really useful kind of way of thinking about what someone's able to engage with at any particular time. Selective or situational mutism. So we've worked with plenty of people where in certain situations they are unable to use their verbal language. They are still able to communicate, but they are not able to access their speech. People who have experienced autistic burnout, thank you, burnout, can absolutely present with situational mutism as well. We see significantly higher levels of anxiety and depression. We see significantly higher levels of self-harm and suicidal ideation. There is significant amounts of research work and resource development going on around this area at the moment. This work by Sarah Cassidy at Nottingham University around developing more effective tools, because the tools that we use at the moment to assess risk are not autism informed. So they are not as effective as they need to be to identify risk. We also might see the behaviour that challenges the services and people around them to keep them safe and well in the community. So there are significant impacts across mental health and wellbeing. Sorry, I was waiting for the slide to change, and it's me. I'll wake up at some point. So we're going to have a quick chat about masking. This is a terminology that is quite new, but it is really widespread use now, I would say, as well, particularly in relation to how a lot of autistic females explain how they may have missed diagnosis at an earlier point in their life. So they're working really, really hard to fit in various social situations and present as neurotypical, hide some of the things that they might find really challenging, hide maybe their sensory sensitivities, hide their communication difficulties, or the things that they might find more challenging, so that other people are not aware of what they're finding challenging. However, what's really, really important is that this will have both short and long-term consequences for that person as well. It takes significant energy to mask, and the recovery to masking can be a significant length of time as well, especially if it's repeated every day. Sometimes people don't know how to if you've spent a day at work and you are masking, what they need to do when they get home to recover that energy. They don't have that strategy in place. So sometimes it's about thinking about that with a person. But on a long-term basis, it can lead to increased risk of engaging in deliberate self-harm, in potential sort of suicide attempts, real difficulties with self-regulation. It can absolutely lead to burnout as well. So it's I think we are understanding all the time more and more about masking, but it's really important that we hold in place what the consequences of that are. It's also really important to hold in mind that because people can mask, it stands that we then overestimate what they can do without the additional support or structures in place to facilitate things. So we can keep expecting the same thing from that person, and we're adding to the load that they need to do. Whereas we could actually be putting a reasonable adjustment in place and making the whole thing a lot easier for them. And we spend a lot of time talking about that in our work. I hope that made sense. We're going to have a think about barriers now.
Yeah, so having a think about different areas, I guess. So environment can be one, which poses a bit a barrier. So sometimes people talk about the environment being overstimulating. So that can be an everyday environment. So whether something's really noisy or overcrowded spaces, and how some of those things sort of increase anxiety or pose a distraction. A lot of people that I've worked with have talked about offices, that they really struggle sort of just in the general office environment. There's noise from printers or telephones, which might ring unexpectedly, and how that's really, really difficult. So thinking about how that space could be different. So, some people might prefer not to be in a hot desk environment. Yeah, and just thinking how the environment can be inaccessible as well. So society, that's a huge one. It's great that things are being acknowledged a little bit more, or maybe there's different training that's going on, but there's still a huge amount of work to be done. The systems or sort of social expectations are not always sort of geared to kind of get the best out of people who sort of autistic people. So just thinking the way that society is set up, it's sometimes a one size fits all approach, which isn't as helpful for everyone. Sometimes some of the adjustments that may be needed for autistic people would be just as helpful for someone who doesn't have autism. But the way that it's kind of balanced out is the opposite way, which doesn't make much sense. And just thinking sort of access to services, people sort of, autistic people find it really tricky. They have to make a lot of, they have to explain a lot to try and just get basic access to support. And just having to think about some of those things. So lack of reasonable adjustments as well. We will talk about that a little bit more as we go on. And we've talked about communication, but also sort of thinking about the way in which people communicate, you know, whether that might be inaccessible. So if it's sort of verbal or email, telephone, it's best to just find out the best way to communicate with that person. Often people can have a reliance on inferring information, so they don't give all the information, they drop hints, they use sarcasm and things like that. So again, there's a lot more to have to figure out, as we talked about earlier. So we'll go to the next one, which next slide, when you're ready. So obviously this is quite a tricky topic to think about, but it's an important one to kind of raise. So it's obviously quite high and a worrying sort of link between autism and suicide. So as you can see there, autistic people are up to 7 times more likely to attempt suicide than non-autistic people. And females are at a higher risk as well. So, you know, we've got to make sure we're taking that into account. Mental health difficulties, we talked about masking and sort of unmet support needs. They are contributing factors to increasing, you know, that gap. And we need to be really aware that the signs that an autistic person is feeling suicidal might present really quite differently to what you might expect in non-autistic people. So, and this could be because of differences in communicating, how they express emotions or interact with other people. Some autistic people find it difficult to communicate their thoughts, or they might struggle to find the words to express their emotion. So don't know if you've heard of the word alexithymia, but that's what that means. So struggling to find the words to express emotions. And thinking about sort of structure and routine, people might see that as a sign that, you know, they appear fine from the outside, but actually internally they may really be struggling and masking a lot. And then also some people just may not want to talk about it. They may sort of end up withdrawing much more, or they might just be sort of more passive in terms of how they generally present as well. So again, could be missed. So really important to consider. So with this next slide, it's just a quick one, but we've just sort of wanted to sort of make it clear, like, it's useful for teams to kind of embed discussions about suicide or self-harm within sort of their assessments or conversations with people that they work with, just to make sure that that risk is considered or captured, and, you know, understanding what people's signs of feeling sort of more unwell or struggling, what they are, because then that helps us to know for future.
Can I just add here, Kavita, is that all right? So the Royal College of Psychiatrists did some work a few years ago around when you're talking usually and with someone around self-harm and suicide, the questions are quite open, big questions, which can be really, really difficult for a lot of people to answer. So they did some work around making the questions more specific and more closed. So that's a really useful sort of reference point, is the Royal College of Psychiatrists. And then we've also done some work around breaking them down even further. So that's something that we can try and share as well, if that's useful, just so that they're more specific. Those big open questions can be really tricky.
Definitely.
Sorry, for some reason I can't switch to all the slides. Do you want to just put this one as a reference? This slide?
Yeah, I can do.
Yeah.
So this is that was just about the accessible information standard. So just useful to be aware of that. You can have a look at that. Okay, so obviously our presentation today, we want to be focusing a lot on sort of reasonable adjustments. So just to make it clear, so reasonable adjustment is a change that must be made to remove or reduce a disadvantage related to a person's disability or difference. So it requires individuals, professionals, staff, services, for example, to take positive steps to make sure that people with differences or disabilities can fully participate in services that are provided. So for example, just thinking, so if someone's got a sensory loss or visually impaired, you know, we would want to make sure that they're getting information in the right way. So you might think about, you know, whether that leaflet is appropriate for them, and whether there's a different way that they can access that information. As you know, it might be a bit more what sort of mainstream, but still not everywhere. Is thinking, you know, for someone who's got a wheelchair, they may have access to a ramp to access a building, for example, or accessible toilet. So we need to make sure these adjustments are in place. Thinking about sort of in interviews, for example, or in the workplace, there are sort of legislation that sort of highlights what the best practice is and protects people against that discrimination, and trying to make sure that sort of the reasonable adjustments are put in place. So also that last slide, which was talking about accessible information, that's specific to the communication side of things. So, you know, people needing to make adjustments really, and give people the information in the way that they need it. Obviously, there's lots more to say on that one, but just to put it in a quicker term. So I'll hand over to Vic here, I think.
Yep. So how can we support? And a lot of that comes through strategies. This section might be a little bit of a whistle-stop tour, but again, it is really important. Adapting our communication approach, excuse me, can be life-changing for some people, especially when at times, you know, the world can seem very confusing, isolating, and quite often exhausting, as already explained, through masking. Thinking about different strategies and how we can use them will hopefully help ease some of these barriers and give a bit of reassurance, adapting them so the need for masking isn't as great as it has been previously.
Okay.
Yeah. So first off, adapting communication. When you look at this, I mean, it's there in front of us. Ask clear, specific questions. Simplify sentences, paragraphs, explain again, as we've talked about, the jargon. Don't assume somebody's knowledge. For example, we have a lot of medical jargon. Half the time I don't know what it is, and I work in it. Or we also have patients or clients who come and they, correct me if I'm wrong, they do know the wording, but they might not necessarily actually understand it. So when you dig a bit deeper, yes, they might say the stuff that we think we need to hear and they understand it, but actually we don't. They're just very familiar with those words. So we need to be really, really careful about that. Allow time to process. Again, this is really, really important. As we quite often like to fill in the gaps if there's a bit of silence. People feel uncomfortable with silence, so you almost, you know, make sure that you start talking because you feel uncomfortable. There's no need, don't rush, just give people time because they will usually just be processing, and everybody deserves that time to process. Again, use visual supports. These are extremely important to go alongside speech and written information. Where are we? Emotions. Label emotions in the moment. Oh, how I've gone past it, sorry. Reduce environment stimuli and stressors. Clear and consistent expectations. Offer options. Support informed choice and consent. do this before you expect the final answer. Ask people how they would actually prefer to be communicated with, you know, make yourself approachable, and be open to adapting and understanding. Here's an example of some accessible information. So on the left-hand side, there is information, and as you can see to the right-hand side, that's right, isn't it? That information has just been, it's been adapted to make it a little bit clearer, to help see what actual information is being asked. There's spacing, there's different, you've got to look at like font can be really tricky. Some people might find some font really confusing, the size of the font. Again, some people might find visuals, you know, helping alongside again the written or the spoken communication. You need to check again about the terminology, making sure that, you know, again, they're understood, and taking out words that don't actually need to be there. We sometimes have a real bad habit of like using a paragraph when actually we could probably get the information across in like a couple of sentences. And do we really need all the little words in between? We're there looking for the key words to pass the information over. So this is something within our service that we offer. If people have been to our consultations, they will be familiar with it. Feel free to jump in, Jess. But very few people have the opportunity to consider their communication needs with support. This is a document that we have created. It's a co-authored communication guidelines tool that clinicians can use to support structured conversations with people they're working with, to think about their communication strengths, needs, and support strategies. It's pre-populated, and they're within the different areas. If it applies, keep it in. If it doesn't apply, you can take it out. But they're all broken down into social communication, supporting understanding, and supporting expression. We find that people seem to, it really does seem a positive.
Has really good feedback, so it's quite easy to use.
Another one is, so this is an example of a talking map. It's probably very small on there, unfortunately, but you could do a talking mat anywhere. You don't need to have any fancy tools or any, you can literally make it up with whatever you want. You can use symbols, you can use photos, you can use words, you can write it down, whatever is suited to the person, but it just helps give time to build a relationship with people that find direct communication difficult. You know, you don't have to have eye contact, you don't need to speak directly to each other. You could maybe not even speak at all if you didn't feel the need to. This is for somebody to help express their choices or to understand a subject and to see how much understanding they have about it. One thing that is quite interesting with the talking mat, I mean, it's so quick, we can talk about this for a long time, but if you're not sure whether somebody does understand, throw in a couple of rogue symbols or throw in a couple of rogue pieces of information. So when they are going through it, it's interesting to see whether they put that as something they enjoy, they don't enjoy, or they put under they don't know. Sometimes that's quite a good telltale sign, again, without having to like directly ask that person. And it's a really interesting but really, really effective tool. The next one is social stories. So again, this is a process that improves social understanding using the specific characters that translate social information into text, illustrations, and titles that are meaningful for autistic people. It's a way of supporting decisions. It's helping to cement information for someone without it being direct, something that they can keep, can refer back to. It's about simplifying information, giving factual information. Again, you have the pictures to support the written or spoken words. You don't have to have the pictures. It's not necessary, but sometimes people actually find them really helpful along with the wording. And again, it's giving the key information and it's taking out all the information that isn't needed. Another one we've got is the comic strip conversations. Again, as it says on there, central to developing an understanding of social misunderstandings, perspective taking, and other people, that's a tongue tie, and other people's thoughts and feelings. And there is a link at the bottom there. It's really good when you're trying to break down social situations, labeling thoughts and emotions. It's quite good if, for an example, if somebody was going to a coffee shop and they were given the wrong drink, you know, you could literally start drawing how has that made you feel, or what would you do about it. You don't need to be the best artist in the world. Stick people, you know, or just the bubbles with it, as you can see here with a smiley face. It's not about how amazing it looks. It's about being able to break that information down so it's comfortable for the person. Again here, I don't know, some people might be familiar, some people not, but this was spoken about earlier about the blob trees. That's an example of one, and it looks really busy, but again, it is a great tool, because a lot of people might not be able to verbally tell you how they're feeling, but they could point to somewhere, or they could look at it for a while, and then that starts to initiate the conversation, the building of the relationship. And again, it's really, really interesting, because there is no right or wrong to a blob tree. There's no guidelines about how to use a blob tree. And we need to be really aware that how we perceive it to how somebody else perceives it is very different. We could look at one of the little blobs and think, oh, that's, you know, that's somebody laying down looking depressed. But somebody else, they might have looked at that and think that's laying down and relaxing. There is no right or wrong to it, but it does help sometimes when people can't explain through through speech. It sometimes shows quite a big, and also it helps to gauge maybe how your session might be. You know, you might have gone in thinking, right, I need to do this today, but if somebody then shows you their blob of how they're feeling, you might then have to change your approach to your session to suit how they're feeling at the time, without them having to try and explain how they feel, because they might not be able to verbalize that. And then again, you've got about another example is thinking about the using a mood diary. Yeah, you could, yeah.
It's a structured tool really to support someone to think about and maybe build vocabulary as well. Think about there's another tool after this one as well, about kind of connecting what they might be feeling internally with what's going on around them, and maybe the emotional label that goes with that. So it's kind of building on this, but kind of needing that support to do it as well, and having a really clear structure to build on it can be really valuable. Not for everybody, but for some people.
Yeah, and then again, another emotional literacy tool. This could be used within the comic strip, it could be used within the blob tree, but we also, within our service, we use it as an independent tool in itself. And sometimes people find it easier to be able to explain how they feel through colour. So it's just another tool to be able to help people explain how they're feeling at the time. I think that's me done.
Well done. So this we're just talking about scales now. Scales can feel like a really useful tool, and they can be, absolutely. But a traditional Likert scale might not always be accessible. So we might need to use our knowledge of the person we're supporting to think about what that scale looks like. So if someone has a particular interest or a particular motivation, I know someone it's been Marvel characters. So can you use your scale and match it with the Marvel characters to kind of support that person to be able to rate themselves, because that connects more strongly for them. Using the numbers doesn't really connect. A 10 doesn't connect to my emotional state. So thinking carefully about how a scale looks can be really, really important, because they can be a really useful tool for someone, but you might need to think about what you're quantifying and how you're helping that person relate to it. So it's just holding that in mind. This is another emotional vocab dictionary, so it kind of could work alongside the mood diary, but kind of building that kind of connection, your interoception, your understanding of what you're feeling internally, and can you find the emotional label that goes with that? Or can you describe it in a different way? Can you, again, relate it to that thing that's you find really motivating, really interesting, is your kind of area of interest? Can you make those connections and build it in that way? So actually a wider group of people have a shared understanding of what you're referring to, and support it in that way. So they're all useful tools that can support people to access things where actually being able to label your emotional state can be incredibly difficult, really challenging if you don't have the connections between your internal state. You might not have a particularly extensive emotional vocabulary. You might struggle to kind of connect your vocabulary to your state, your internal state. So there's lots of things that can be really tricky with this bit, and having different sort of resources to support can be really valuable. Kavita, I think, is this you?
Yeah, so I won't spend too long on this, but it's just a really quick reminder that time is a really abstract concept. So, and it's so, easy to just say things like, give me a minute, or I'll be with you in 2 seconds, or equally, hang on. That reminds me of that Michael Barton image that he drew, that, he might see that really literally and doesn't, that's what he'll focus on instead of what people are actually saying. I think he drew an image of someone hanging on a cliff, by the way. So just thinking about, when we use those terms really quickly and without thought, that actually that might not translate exactly, and it can have an impact on someone's anxiety, or, they might be really waiting for you to start that conversation in 1 minute, for example. And just thinking also, time is a really abstract concept, even from people when they plan their own time, or imagining how their day will go. Sometimes also, people can see it as a double standard if someone is sort of expecting them to run to time with things, but then that person themselves might be late for an appointment. But it's just really giving it some thought to think about, actually they might be late because they struggled to find that the place to come, or, they were so anxious, for example. I find a lot of people often come really early as well. And, people have to put a lot of time aside to get to that one hour appointment, wherever the hospital might be, because they might have to really plan that route. They're so scared that they don't want to be late and that kind of thing. So it's really appreciating that, the effort that people are putting in, and the fatigue that can lead to.
Sorry, Kavita. I'm aware of the time as well. We're not doing a great time of managing our time. We've just got lots of slides.
Yeah. Well, the next slide can be, something that people read back in the slides, because they will be sent out to you guys.
Yeah.
So there's just some pointers on how to be more explicit, or, making sure we're giving people the information that they need so that they can know what to expect and come to a session. Sometimes just saying someone's not arrived at their session, it might be because we haven't done the right work ahead to prep them to feel comfortable to come. But yeah,
I think it's really important to hold in mind that telephone calls can be incredibly challenging as well, really difficult. So thinking about that and what you can do to make it easier is really important. Again, these are kind of just top tips that you can refer back to, in terms of kind of thinking about how to support appointments, making appointments, supporting people to actually get themselves to an appointment, giving explicit permission, giving really clear details. They're just there as reminders, really. We've got some of your strategies, kind of just kind of summarizing and pulling together all the different bits that we've been talking about, things that you can kind of hold in mind to kind of moving forward with your own work in terms of when you might be working with someone who's autistic. Hopefully that's useful. And that is the end. only 15 minutes over. Well, 10 minutes. We started 5 minutes later, but yeah, apologies.